children under the age of 5 that we have seen come to our emergency department has been like nothing I've ever seen in my 30 years of practicing infectious diseases.
Normally we see kids on oxygen for just a few days. This year though, I've been seeing kids last 7-8 days still needing a little bit of oxygen, taking time to wean off, which has been different from prior years.
RSV, which stands for respiratory syncytial virus, is a virus that has been around for decades. Thousands of kids on any given year are infected by RSV.
At least 58,000 U.S. children under age 5 are hospitalized each year with RSV, and between 100 and 300 die from the virus.
Right now, we've been seeing an increased number of RSV and flu cases, and it's been a lot earlier than most years. The biggest ordeal that we've kind of run into is the volume of patients. So not only are the viruses hitting earlier in the year, they're kind of coming back with a vengeance that we haven't seen because we've been so isolated for the prior 2 years. Kids are just not used to these viruses like they might have been in prior years, and that could lead to them becoming a little bit more ill than previously.
Some experts in the medical community believe measures taken to mitigate the spread of COVID have put children at greater risk of viruses like RSV and flu.
I do believe that influenza is a significant threat for us. And while RSV is a problem, RSV is manageable after 5 or 6 or 7 days. Influenza is a different beast. Influenza causes something called necrotizing pneumonia, which can really affect the lungs much more severely.
Total hospitalizations and deaths from the flu nearly doubled in the U.S. between the weeks ending on October 29th and November 5th.
When a virus affects the pediatric population in a more severe way, it puts a lot of strain on critical care capacity, which requires very specific nursing, respiratory therapy, pediatric care providers that know how to do this for little children. And it's not the same as adults. Children are not little adults. They require very different care.
While a vaccine for RSV is still in the works, doctors are encouraging parents to vaccinate their children to prevent serious illness from COVID-19 and the flu.
There's something parents can do about this, and that is to get their kids vaccinated against influenza, and do it right now. Do not wait.
I want everyone to remember that RSV is a common cold virus and not every kid is hospitalized. So keeping a good eye out on how they're drinking and breathing, knowing to call your pediatrician or family medicine doctor first to get great advice.
As pediatric care providers, we know how to treat all 3 infections: RSV, influenza, and COVID-19. We will be able to provide support for your children. That's really, really important. Do not panic.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.